The one thing that I like about the Cheile Network, anybody can acquire a disability or a health problem any day, any time. I love the word Cheile. It means together. I really feel that in the Cheile Network, in the HSE, we are together.
Welcome to the HSE Talking Health and Wellbeing podcast. My name is Fergal Fox, and in today's episode we're talking to two people with a disability about their working lives in the HSE. The HSE want to support people with a disability to work and thrive in the HSE. So HSE HR convenes a network called the Cheile Network to support people with disability in the workplace. Our guests today are Gráinne Leach, who's an Equality and Inclusion Officer in HSE HR, and Kellie O'Farrell, who works as a Senior Occupational Therapist in primary care in Kilbarrack in Dublin. Guys, you're both very welcome to the podcast.
Thank you.
Thank you, Fergal, for having us.
The HSE Diversity, Equality and Inclusion Team, or DEI, convene a network called the Cheile Network to support employees with disabilities, neurodiverse conditions and long-term health conditions, as well as their allies. And we will hear more about this network in the podcast. So this is a sensitive and important topic, and I want to say thank you, first of all, for putting yourselves out there, for taking part in this podcast. Very important message that we get out to the public and to HSE colleagues about working in the HSE with a disability. Can I ask to tell me where you are coming from? Kellie, maybe I start with you. Where are you coming from in terms of this network?
Well, I currently am, as you said, a Senior Occupational Therapist in the HSE. I also currently hold the role of chair of the Cheile Network, so I do. I got interested in working with the DEI team in a voluntary basis because I am a person with a disability myself, and I had faced some challenges in the workplace when I entered the HSE early on, and I realised that I needed additional supports in order to do my job. And that's what led me to contacting the DEI team. And from there, I got engaged in their various projects and works that they do within the HSE. So I'm delighted to do it. It's a great group of people and a great network. I'm very excited about what we're doing now and what is to come in the future.
And can you tell me a bit about your own disability then?
Of course. So I have both a very visible disability and an invisible disability. So when I was 2 years old, I was burned in an accidental car fire. As a result, I sustained significant injuries on my face and significant life-changing injuries to my hands. So my physical injuries are extremely noticeable, and I've had numerous hospital admissions for reconstruction surgery over the years, both in Crumlin Hospital and St. James's Hospital since I was 2 years old until current day. I've had my last surgery actually just about 8 weeks ago. I've had a fantastic team of surgeons and nurses and healthcare professionals who have worked tirelessly to help me be independent and functional after my injuries. Now, my invisible disability is I actually have quite severe dyslexia. So that's a disability that no one would notice and no one would know unless I told them. But my dyslexia, funnily enough, was the disability that actually caused me the most challenges in the workplace, despite being what may be considered the less of the two, just because my physical injuries are so noticeable to the world.
Wow. That's an awful lot of stuff you have to share in there. So you've been on a journey as a patient and a healthcare journey after your injuries, and then the piece about your dyslexia. And that's amazing that was it's hidden, but you needed the support around that. That's interesting.
Exactly. And yes, I have been on a journey as a service user of the HSE, and I have to say I've had a fantastic care myself as the person who needed the healthcare services. My medical team has been very dedicated to me, and I really appreciate that as a service user perspective. I ended up becoming an occupational therapist in my late 20s. I actually had another career before that. I felt when I came out of college that I didn't actually want to work in a healthcare environment. I wanted almost a step away from being the person with the disability, and I wanted to do something else. So I did work in London in a different field for a few years. But strangely, when I kind of got that out of my system and I worked in a different area, I actually worked in media, I realised then I really am very interested in healthcare provision. I'm extremely interested in advocacy and supporting people with a disability to have a more successful, fulfilled life. And I realised that's where my passion was. So I actually went back and done a master's in occupational therapy, and I ended up a clinician myself. I don't know what took me down that journey. I suspect it is my own life experience, but I took the break away from it. I stepped away and I came back naturally to it in my own time.
Wow, that's unbelievable. Thanks for sharing that so simply and so well. I think your journey to your current occupation is very clear, that you've been affected and you can see the importance of healthcare provision, and you're right in the middle of it now.
I needed the time. So when I was quite young as a teenager, I got involved in public advocacy in the UK, actually, around the area of visible difference and disfigurement. And I'd spent a lot of my teenage years and early 20s talking about disability, disfigurement, scarring, and the impact on my life and the life of other people. And I just felt at that time, at about 22, I said, I need to step away from this. My whole identity was my disability. And I took the break away and I'd done something completely different. And I'd done a master's in television journalism. And having that 5-year break away from nothing to do with a disability refreshed me and actually made me realise, no, I want to dedicate my life to this line of work, working with other people with disabilities. But I needed that psychological break at that time myself. I needed to not be a patient and just be a young adult.
Yeah, it's fantastic career advice. Full stop. Gráinne, can I come over to you there now in terms of your disability and why you're part of this network?
Okay, so I acquired my disability when I was 22. I was working in Jervis Street Hospital at the time as a clerical officer, and unfortunately I got knocked down by a bus off my bicycle, and I had my right arm amputated along with lots of other injuries, broke my leg, fractured my pelvis, had many, many injuries. I was right-handed at the time, so I often look back now and think, God, that was in 1984. I think about it, my parents must have been up the walls worrying whether I'd be kept on or whatever. So because a lot of my work was involved typing and everything, and as I said, I was right-handed. So I had to learn. I actually was here, as we're recording here in Dr. Stevens's. I spent many months here in Dr. Stevens's in the skin grafts and having different procedures done here back when it was a hospital. Yeah, and I was very fortunate. I met a man who was a graphic designer and he showed me how to start writing. So I started to do slants rather than going like, if you see sometimes people who are left-handed, they kind of turn their hand in, where this gentleman told me to go by slants. So you think about M is like up and down, up and down. So I learned, I did a lot of practice on that. And then I can't remember when, because I was out of work for a long time. And obviously I would have had to go to the rehab in Dunleary as well. I too had good experiences and not good experiences, I have to say, because it was a long time ago. It was 41 years ago. So the care I got in the hospitals was amazing. But I was very fortunate. There was a fantastic leader, Mr. Leo Vella. He was the Accident Emergency Department consultant in ED at the time, and he actually welcomed me back. They trained me. They got me into the reception, so I didn't have to type then. So I started working in the reception of the emergency department, welcoming people. I love talking to people, love meeting people. And actually, I think my parents were very relieved. I was very lucky because in those days, people with disabilities weren't employed.
You were a young woman.
I was 22 when it happened. Very traumatic, very traumatic. And I can remember the bus reversing off me. I was playing National League basketball for Meet Louis' basketball team, and basketball was my drug. So I ate, slept and drank basketball.
Wow.
So like that was a huge change for me, that I couldn't play basketball anymore. I tried, and to this day I still have great friends from basketball. Actually, one of them's coming home from America next week and we're going out for dinner, 6 of us. So I have great friends and I got great support from my family and my friends during a very trying time. But I have to say the people I worked with in Jervis Street Hospital at the time were amazing, absolutely amazing. And some of them are still my best friends today. You know, they were very kind. They were very caring, very supportive. When I look back, I, of course, didn't realise, because I was only 22, the trauma and the impact of losing my arm and the detrimental effect it was going to have on my life going forward, not just as a person, but also as a person working and subsequently being a mum of 4. So it had a lot of challenges over the years. But I have to say, when I reflect, Mr. Leo Vella's passed now, but I'll never forget him as long as I live. And in 1987, Jervis Street Hospital and the Richmond hospitals both amalgamated and we moved to Beaumont. And again, I was working in the ED department. Mr. Leo Vella played a vital role in making that move to Beaumont very easy for the staff that worked under him. And he was very supportive. He made the move very easy. I remember good times, meeting new friends, meeting new colleague. It was really, really good. But I wanted to do better. I got married in 1989 and in June 1989. And in September 1989, I decided I liked meeting people. I liked going to events and stuff. I decided I would do a diploma in public relations in the Royal College of Surgeons. And subsequently, following that course, there was a new person appointed to manage the IT department in Beaumont Hospital, Mr. Tony Kenny, and he was looking for a PA. And I was one of 20 people who went, and everybody who went was able to type. So I had to retrain myself to type. But he believed in me and I got the job. So I was his PA until I left Beaumont in 1998.
Okay. I'm just picking up on the themes here that, you've both been through really traumatic incidences, and, your experience with healthcare it's really embedded in your life experience. I know everybody's work experience is embedded in their life experience, but it's nearly more when you've experienced trauma and you're coming to the workplace with a disability and you have to kind of sort all these pieces out in your head and you want to be supported in the workplace. Going back to you, Kellie, in terms of coming into the healthcare arena, you're working in the HSE now. How long are you in the HSE?
I qualified as an occupational therapist over 7 years ago, and I've been working in primary care in the HSE for the last 5 years.
And how has that been for you?
I am very fortunate that I work with a fabulous team in a fabulous health centre. We're all very supportive of each other. We really do strive to try our best to provide high quality healthcare to the service users of the HSE as best we can. But personally for me, the reason why I suppose I've stayed in the role is it's a busy role. It's not an easy job. It's a busy job.
Yeah.
But the reason why I have stayed in the role is the support of my other OT colleagues, the support I get from my line management, and the support I get from the diversity, equality, inclusion team. If that infrastructure wasn't there, I don't know if I would have stayed. But because I feel so supported, the HSE has retained me as a staff member, and I am very happy in my role. But saying that, it wasn't all plain sailing. I did have challenges at the beginning. I felt I was staying really late in the evening, working many hours overtime in the beginning, probably for the first 12 months. And I started to not like my job because I felt, God, I'm leaving here every evening, 6:30, 7 o'clock, coming in early, trying to keep on top of the paperwork, because everything now in the health service is very paperwork heavy, particularly a clinician's role. So the documentation side of things felt like a huge weight, like a brick on my shoulder, holding me down, affecting my own personal life, where I wasn't doing things outside work in the evening, like going to the gym or meeting friends. And then I was exhausted at the weekend because I'd worked such long hours. In the end, I had to disclose or share with my supervisor, my clinical supervisor, how I felt. It was that sharing of this information is what triggered the need and the action for me to have reasonable accommodations in the workplace. Now, that isn't a streamline, plain sailing experience, I have to say. While I'm very positive about things, I'm very honest as well. And I have to say that was challenging, getting the reasonable accommodations in place in a timely manner to what I needed in order to do my job.
Yeah, and the reasonable accommodations, that's one of the key things we want to touch on today, because I think that's important for a manager to realise, somebody tuning in here today, somebody with a disability, to know that sometimes there are tweaks, sometimes there are changes, or there may be a bit of extra technology or a bit of extra support. The support word is coming through very strongly from you both here. But Gráinne, what's your experience of that?
Well, I can concur there with Kellie on working the long hours. I live on the south side and Beaumont Hospital, is on the north side. So I used to have to commute. There was no M50 at the time. And because I would have been really busy, and because of my disability, with only having one hand, there was many nights I wouldn't get home till 10 or 11 o'clock at night. I'd be doing reports and everything. Now, that was back in 1990, 1991. But I felt the support was there with my manager, which was really good. Now, he didn't expect me to stay that long, but obviously
You were trying to do the best you could do.
I wanted to do the best I can, and I suppose I wanted to prove that I was equally as good as somebody with two hands. But it did take its toll on me after I had my first child. It took its toll on my mental health because I got completely exhausted. Not only did I get postnatal depression, but also after my first child, who was born in 1993, in 94, I got completely exhausted and burnt out because not only was I dealing with postnatal depression, I'd never dealt with the loss of losing my arm. There was no such thing as counselling or anybody supporting you back in the day because, like, we were in a different era. Mental health was a taboo subject. And I had to reflect then. I knew when my second child was coming, I knew there's no way I continue travelling long distance, working long days, like very, very long days. So I tried to get a job on the south side, and I would actually disclose my disability because I felt I needed to disclose it. And unfortunately, at the time, I wasn't lucky with jobs. And then when I went for my job, which was the former Eastern Health Board, I actually forgot to say I've only one arm. And believe it or not, I got the job. Hence, I'm here today. So, yeah, so it was funny that happened. And I had to reflect and think about my own health and well-being, which is most important for us all.
Yeah, I'm struck by that challenge that you had in a time that didn't really, as you said, didn't really appreciate that you had unprocessed trauma. And then you were going through the challenges of motherhood and overwork, and it's so easy to burn out when you're overworking, Kellie.
I think the risk is there. People with a disability can suffer in silence because I work in a fabulous team, I have to say, but people weren't coming round on a regular basis asking me, was I okay? Was things okay? I was suffering in silence. And I know suffering in the sense that, okay, I had to work long hours, people wouldn't think that's suffering, but at the end of the day, everybody knows a frontline clinician now is not an easy job. It's a challenging job. We're working under a certain amount of limited resources. So having to stay late on top of that to get my paperwork done, it was taking a big toll on my life personally. And there wasn't really anyone asking me how I was. I don't think anyone knew. So I think I probably stayed late for a year and no one knew any of it wiser.
Yeah, I think as well, Kellie, that was the same. Nobody knew it.
Yeah.
I wasn't open about it either.
Either was I.
Yeah.
I was nearly afraid that if I disclose this, I was junior in my career, if I disclose this, sure, I'm never going to get a promotion. I was nervous. I was afraid. I had fear of disclosing it.
Yeah.
When really there was no need for me to be afraid. It wasn't a disaster when I disclosed it, but within me, I felt fear.
But that's what's great about today, Fergal. Like the DEI team are doing a lot of work around openly disclosing if people, obviously it's each individual's choice to open disclose whether they have a visible or an invisible disability, which can be much more challenging. Like people can see I have one arm, but they wouldn't see like on a daily basis if I struggle with my mental health unless I divulge it.
Yeah, yeah.
The HSE, the DEI team, setting up the Cheile Network, which is absolutely has been life-changing for me, I have to say, in work. I've met like-minded people. I felt supported by the DEI team. I've felt supported by the members in the Cheile Network. I can also say that they have felt supported by me. Kellie does a wonderful job as chairperson of the network group.
So how long have you been part of the Cheile Network?
2 years.
And yourself, Kellie?
The same. We both started together, me and Gráinne.
Yeah.
2.5 years, the network is in operation to date. And I think definitely in the 5 years I've entered the HSE, I've seen a lot of changes around diversity, equality and inclusion. I really feel like it's a hot topic now, and it is a topic that comes up regularly in discussion points at meetings. Previous to that, I don't know if there was much discussion around it. I most certainly didn't ever hear of the DEI team or knew who it was. But I think in the last 5 years, it definitely has become a hot topic. Not only in the HSE, but in a lot of different workplaces. I think we're definitely discussing the issue and the topic more. And like that, people need to remember listening in. You may not have an illness, injury or disability now, but it's something that you can encounter across your whole lifespan. Injury and illness can happen to anyone at any time in their life, at any age, and it can have a dramatic, life-changing impact. And maybe the people walking around without a disability now, it might be something that they have to face down the line. So I would ask people to stop and think and be empathetic towards people with disabilities, because maybe one day it's them or someone that they love very dearly within their family unit.
Well said. Well said. So you've been both part of the Cheile Network, and the HSE's value and diversity and inclusion message is better for staff, better for care. So you can see that, like just in your point there, Kellie, having empathy or having understanding or putting yourselves in other people's shoes. That's exactly how the HSE is encouraging staff to think about the patient-centred approach that we're trying to take. We have to take a staff-centred approach and support staff, or we won't retain them.
Good engagement brings for best outcomes for everybody. You know, if you engage with somebody with dignity and respect, whether they have a disability or they don't have a disability, we have a better culture in our organisation. People value each other, they respect. We have the values of the HSE: trust, care, compassion and learning. And the one thing that I like about the Cheile Network, as Kellie alluded to, anybody can acquire a disability or a health problem any day, any time. In Ireland now, cancer is a huge issue. Mental health is a huge issue in Ireland following COVID. And I think we all need to be a much nicer, caring society. Smile when you meet people in the day. It's so important. The other thing I think I'd like to say about the Cheile Network, I love the word Cheile. It means together. I really feel that in the network, in the HSE, that as a group in the Cheile Network, we are together. We sing off the same hymn sheet. We support each other. We want to improve. That's the thing. We want to improve the situation for staff, to retain good staff, because people with disabilities, they might have a disability, but they're well educated. Look what Kellie just said. I'm shocked. I didn't realise you had a master in journalism, television journalism, which I would have loved to have done, by the way. I might do it yet. My retirement. I didn't know that till today.
Never too late.
Oh no, it's not. I might.
Can I bring you on to, it's great to hear you talking with such, enthusiasm around this topic, because you've been through really challenging pieces and you've engaged in the workplace. You're really thriving in terms of the sense I get off you that you're using the network as it's adding energy to your life in the workplace. Can I ask you about reasonable accommodations and practical supports? I think this is a key piece for managers and for staff, obviously. But what's been your experience of that reasonable accommodation?
So reasonable accommodation, just so people are clear what it is, it's about removing barriers for employees with disabilities or health conditions so they can carry out their duties on an equal footing with their colleagues. And that's what's really important, that the barriers removed. Like I have had experience where, as I've gotten older, obviously, you have more challenges as you get older in life, and call a spade a spade. And the reasonable accommodation that I was granted was working from home, and that was in consultation with HSE Occupational Health. And that was a huge benefit to me. It gives me the opportunity to be more productive, I would say, absolutely more productive. By reasonable accommodation being granted, you adapt better. What I need today is different to what Kellie might need. And your experience of reasonable accommodation, would you like to talk about that?
Look, I can't change what happened to me. I am a burn survivor. There's no taking these scars off my face. There's no going back. I will never have the face back or the fingers back that I was born with. And I know that. But as a functioning adult, I need to still go out and make a living and survive and thrive. And being in full-time employment is extremely important to me. But something that I can do is I can campaign for better conditions in the workplace. I can campaign for a more just and equal society, but other people can also support me as someone with a disability to thrive in my workplace by allowing me to have reasonable accommodations. Now, when I say reasonable, they have to be reasonable. They can't be unrealistic. The reasonable accommodations I actually got in the workplace, I got a few different types of software packages. That one is a dictation software package that I can talk into my computer and it types my notes for me. The other one is a read back software. So it highlights all my documents and I can actually listen to the audio of what I've written. Now, those reasonable accommodations help me significantly in my day-to-day life. I also have an office of my own because you need quietness in order to dictate. Now, the one challenge, while I got the reasonable accommodations, And my line manager is so supportive. She, at the time, I was line managed by an OT, a very senior OT, extremely supportive, wanted me to have these changes. But there is no streamlined process in the HSE from sharing the disability to obtaining your reasonable accommodations very quickly. The request seems to go up into a big black hole of what happens after you send the email. There's all challenges then about whose responsibility is it to order the equipment? What budget does it come from? How do we get it? So from day dot of me disclosing my disability, it took about 7 or 8 months actually getting the equipment sitting on my desk, possibly even longer, only because there's no disability officers in the HSE at the moment dedicated to supporting staff with disabilities. And there's no set, streamlined process of obtaining reasonable accommodations. So I feel when a disability is shared, a lot of line managers don't know what to do with this information. Who do they go to? How do they make the changes? The willingness there to help, but the actual support about getting that help is slightly lacking. But I know that the DEI team are working immensely at the moment to try and put the infrastructure in place to make it a more streamlined process about obtaining reasonable accommodations.
Okay. So Kellie, you're obviously so engaged on this. You're advocating today for improved systems around that reasonable accommodation because it is a bit fluid and it is a bit of a grey area. But so many managers are supporting so many staff and we're trying to increase that.
Yes. I definitely feel that the HSE has committed in the last number of years to really reinforcing the fact that line managers must support staff with disabilities employed within the health service. I think there's a lot of learning that still needs to happen in terms of if someone is employed in a line manager position, they need to be aware of the responsibilities and duty of care to a staff member who has shared a disability. The DEI team, for reference point, has developed a lot of guidelines. There's a lot of rich information there to guide a line manager in the decision making. What I would say, don't be afraid of change. Remember that empathy and compassion is free. It doesn't cost. And if you are able to make life a little bit easier for your staff member, that person is going to feel more fulfilled in the workplace and they're going to have a higher level of productivity. Don't be afraid of change. It might take a bit of work and a bit of movement around, but it's not impossible. I would ask that line managers don't make their own decisions about reasonable accommodations without seeking guidelines from the policies and procedures that's in place. It is important that you make yourself aware of that. If you're employed in a position where you're managing people, there's rich information there. I've read the guidelines myself. I can see that the words and the experiences from the Cheile Network has been captured in the guidelines because the words I read are the words that has been repeated by our network members at the meetings. So you're getting real life rich information in those guidelines and I would direct people to look at them. But as an OT, I'm expected by the HSE to show compassion, empathy, consideration to my clients as service users. And I think if we're expected to show that to members of the public, we are expected to bring it into the workplace as well and show the same level of respect to our colleagues.
Okay, well said. So I want to ask you about different types of disabilities. You're saying you have a physical disability, you're saying you have a visible disability and an invisible disability. Can we share some more examples so people tuning in here today?
Mental health is an invisible disability, as I alluded to earlier on in the conversation. There's so many young people coming out of college now, want to get into the health service. You know, you would have OTs, social workers, everything. But they've all could have been through college during the COVID times. And I think good support's in place, letting them know. One of my roles as just joining the DIT will be advocate. Let people know that the Cheile Network is in place. The DEI team are just amazing, the supports they give. I think it's about education. It's about informing, showcasing the work that has been done and also showcasing the work that has to be done, both for people with visible and invisible disabilities. As Kellie said earlier on as well, none of us know from 1 minute to the next. 1 minute I had 2 arms and then I had one arm.
Yeah.
And that was like, when I look back, I certainly would not like any of my children to have gone through what I've gone through in life and the challenges I've had to face. And as I said earlier on, it's affected me not just on a daily basis and learning to manage, but also it did affect my mental health. So every day I have to manage my mental health, manage my disability. So one is visible, one is invisible. Now I feel fortunate, even back 10, 15 years ago, that I was able to speak about mental health because I had a reason to be sad. I had a reason to be sad because I'd lost my arm at 22 years of age. And that's only 10, 15 years ago, where I was able to come out and speak about it. And I think nowadays there's a lot of work going on in the HSE. And I think we need to build on that to encourage people to talk openly, to learn from each other. But the one thing is just to respect each other and just be kind to each other. There is a lot of illnesses and disabilities in Ireland today.
Kellie, can you tell me about other disabilities that people might be considering or maybe wouldn't consider?
Well, obviously, there's a wide range of different types of disabilities out there. It's a broad genre and spectrum. Obviously, some disabilities are physical and visible, some disabilities are invisible. But not all illness and injuries are lifelong. You may have a lifelong injury, which occurs in lifelong disability, for example, physical disability, but you may develop a short-term chronic illness that for a short period of your life you were quite unwell. If you're lucky, you'll get over that, but maybe for that short period you do need adjustments in your workplace. The other thing that's very topical at the moment is neurodiversity and mental health, as Gráinne has said. You can't put disability in one box. You may have someone who has a sensory disability, neurodiverse disability, mental health related issue, communication difficulty, visual impairment, hearing impairment, physical disability, a wheelchair user, walking aid user. It's very broad. But what's very important to remember is how one person's life is affected by their disability is very different than someone else's. You may have someone in the workplace with a disability that needs no form of reasonable accommodations at all. Or you might have some person in the workplace where their need for reasonable accommodations fluctuates depending on their illness or injury. Their health may fluctuate throughout their life course, so they may need reasonable accommodations on and off as that health fluctuates, particularly people with chronic illnesses. They may have a very good 5-year run where they're able to work at a certain level of productivity, but they may have short periods of time where they're not feeling very well and they need the leniency from the line management to allow them to attend to their medical needs or attend hospital appointments, for example, or maybe a shortened working day or take a block level of annual leave to give them a rest. And I think that's very important to understand that just because you're not affected by disability, you can't just say, oh, well, I don't understand and I'm going to have this negative view because I don't know what it's like. You have to be open-minded and try to understand and ask that person, have an open, honest conversation with a certain person who is disclosing a disability to say, what do you need? What can I do? How can I help? As I said, empathy and compassion are free. They're basic human nature instincts that we should show towards any member of society, inside or outside the workplace. But you have to remember, particularly maybe as people age, chronic illnesses can get more severe, and that's very important to recognise that.
Okay, thank you. Well put.
I was going to just say on that point as well, Kellie, I think, openness and have a good relationship with your manager. Your manager has a good relationship with you, good communications, and that they can support you. So if you are open with your manager and you feel you can share your disability with your manager, well then, you will get the supports that you need. And I think being open and being honest and being respectful, both ways, the employee and the manager, that will again lead to better outcomes and also help the person if they've got to go for their hospital appointments as you said, take a break, take a holiday. But by sharing the information, then the manager is aware of what the employee needs.
And I think if we can't provide that within the staff team workforce internally, how can we be expected to provide the same level of care to the people of Ireland? It starts at home. And then if we are working in a culture where we feel supported, I think we'd be able to provide better, higher quality health services. I have a disability, but I need to earn an income. And that's important. I have to make my way through life. So my work is incredibly important to me. Thankfully, I can work full time, but I need to be able to do that for the rest of my life. I have to live, I have to earn.
Yeah.
And that's the reality.
I really appreciate your participation on today's podcast. You've shared deeply personal information about yourselves and you shared your experiences in the workplace in the HSE. You've also recognised the HSE is on a journey, Kellie, and some of your points are really pushing them on forward as well in terms of that. Let's talk about some of the resources and information that are available there for managers in particular and staff, either seeking employment in the HSE or in employment in the HSE. And as you say, Kellie, this isn't a one and done. Things change throughout people's life course. Loads of people work in the HSE for 20, 30 more years, so things can change.
36.
36. Well done, Gráinne. You're the winner.
I'm the winner. A long time. Yeah, give my age away now.
Let's talk about the resources and the information so we can just signpost people to, a deeper engagement in this. I was looking at the videos around reasonable accommodation last night and I thought to myself that some of the accommodations were so simple and small and there wouldn't be a huge cost. Now, some of them for a manager, you think, where am I going to get the money for that? If the manager isn't clearly directed on it or there's not a clear policy on it, they could put it on the long finger or say, I'm not sure how to make this decision. So I can see that it's important that managers are clear that reasonable accommodation is expected.
I think the HSE is a huge organisation, and I think sometimes from a personal point of view, finding information can be difficult because sometimes you're trying to find a needle in a haystack in a huge national health service. But what I have to say, I do feel that the HSE is fully supporting diversity, inclusion, equality. I actually think the people that run this organisation really want people with a disability to sign up and work in the health service, and I think they want to support us. It's just about getting the information, trickling it down to the people who need that information on a day-to-day basis, which would be the staff members who have a disability and the line managers who's managing that staff. And I sometimes think maybe some of the workforce aren't aware that the level of supports are there, that they actually exist through the Diversity, Inclusion and Equality Department. There's really great resources and guidelines that have been signed off by the HSE that are there, that they're in practice, they're there to be used. Go read them.
Yeah, the HSE DEI team offers guidance and support to staff and managers on disability and reasonable accommodation. And you could contact the DEI team at diversity.hr@hse.ie. The sharing status information in the workplace, reasonable accommodation and inclusive communications for disability guidelines are also available on the DEI page, which has absolutely got loads of information, and the DEI hub on HSE Land. And there's a lot of training courses on diversity and inclusion and working within diverse teams on the HSE Land as well. And finally, if anyone wants to join the Cheile Network, well, they can contact me or the HSE diversity team on diversity.hr@hse.ie. And I would encourage, and I'd love to see more people join in the Cheile Network. We meet online 5 times a year. It's a wonderful network. There's wonderful people, very smart. A lot of people with lots of experience.
I'm sure there is. I feel privileged to have met 2 stars from the Cheile Network today.
It's important to add that people join the Cheile Network for different reasons. But I do think the one thing we all share in common, the Cheile Network, I know it's on Zoom, it has people joining from all over the country, but it is a fabulous resource of peer support. And the HSE, the execs who run the organisation are delighted to know that we have that resource. They fully support us. I do know definitely I joined it. I no longer feel alone as an employee with a disability. I feel like I have other people who share my experience to talk to, and it is a great way of peer support.
Yeah, that's fantastic to hear. It reminds me of the point that you were making of that empathy and compassion is free, that peer network is very low cost.
It is.
It's of unbelievable value.
Exactly.
I would encourage managers for staff who have disability, to get them to attend the Cheile Network, people, and let them know it's available, because it's a brilliant group of people, as I said. So before we conclude, here are some resources that listeners might find useful if they want to learn more or become involved. The HSE DEI team offers guidance and support to staff and managers on disability and reasonable accommodation. You can contact them at diversity.hr@hse.ie. The sharing disability status information in the workplace, reasonable accommodations and inclusive communications for disability guidelines are available on the DEI webpage and the DEI hub on HSE Land. And training courses on diversity and inclusion and working with diverse teams can be accessed on HSE Land as well. And finally, if you want to join our wonderful Cheile Network, you can reach out to the DEI team at diversity.hr@hse.ie.
We'll put those contacts and any other information you have on the podcast information section wherever people are listening to this podcast. So I want to thank Gráinne Leach, Quality and Inclusion Officer with the DEI team in HSE HR, and Kellie O'Farrell, Senior Occupational Therapist in Primary Care in Kilbarrack and Dublin. I want to thank you both for your deep engagement and very personal contribution to the podcast today, and huge encouragement for people out there with disabilities and huge information for people in the management roles and guidance roles around what needs to happen in this area. So really appreciate your input today. To the listeners, thanks for tuning in to another episode of the HSE Talking Health and Wellbeing podcast. If you want to find out more about HSE Health and Wellbeing, you can check out our website, our LinkedIn, or our channel on X. And if you want to join our mailing list, email us at healthandwellbeing.communications@hse.ie. Thanks for listening.